None of us wants to give in to living half-hearted or half-assed at the end of the day. Like, I think at this day and age, we're at a beautiful moment where science has gotten to the point where we can really identify what is going to make you the healthiest, the happiest, the most productive. And what are you going to pay attention to? Like, what are you going to invest in? Hi everybody, my name's Aaron. I live in San Clemente, California, and this is day one for me on my game day journey. I'm excited. I think I've tried to do a lot, especially in the last, 12, 15 years, to try and ensure that I'm as healthy as I can be at my age. I just turned 50 this year, and so certainly on the back end of, in some degree, advancement and progression. And I've done all these things, whether it be exercising or taking supplements or eating well, and you kind of feel how your body's feeling in general, and you think, okay, I think I'm doing things that are positive for me overall, but you don't really know at the end of the day. And so I think I'm most curious about peptide dosages, testosterone. Those are the things that I kind of feel are right up my alley based upon the simple research that I've done. Trying to execute the process and the program, I guess. It's like, can I stay on top of everything? Can I manage the entire process? It's like, am I healthy for a basic level human being? But it's not really thinking about, am I healthy for somebody who's really trying to push themselves every day? I did recently subscribe to a mail order program where they do the monthly blood tests, and they can prescribe different hormone replacement therapies. The things that I think the mail order service lacked, and the reason why I've kind of continued to try and find another solution and another option for me to be able to monitor these things that I'm concerned with, is it was relatively impersonal. The ability to connect with those people, I got to be honest, 3 times I was trying to connect with my primary care doctor that was working through my blood work, and it was a challenge. When I had questions, trying to get those questions answered was really challenging. It took 2 weeks for me to get questions answered on some new blood work that I had done that didn't really align with the initial blood work I had done. So I just didn't feel like I was getting a professional's advice and a professional's direction necessarily through the entire process. They're like dipping into certain parts of the process, but not really taking a holistic view of, this is the patient, I want to figure out what the best treatment for this patient is across every single facet, and I'm going to set up the full and complete regimen on when do we do blood tests, when do you do injections, what are we injecting. Or I'm looking for a second opinion on kind of the testosterone understanding that I have, some of the things that were prescribed by that service that I initially jumped into, and trying to validate what they've told me, and get a bit of a second opinion, and then utilizing all that information to find the best possible solution for a go-forward plan. I'll tell you, I was surprised to get results here today. That was certainly surprising. It was no, we're going to send out for labs and we'll get back to you in 3 weeks. Now, don't get me wrong, there are some things that I'm still going to have to wait to hear about, but the basic panel was done today. So they drew my blood. I sat down with a physician's assistant and a physician, and they were immediately giving me a breakdown on some of the things that they're seeing and some things that I want to try and address with my health. And then the beauty is then we're going to get a secondary panel that kind of confirms some of these assumptions and allows us to continue to stay on track. So that was certainly surprising. And then again, reassured by the idea and the concept that we're really honing in on the specific things that we need to be focused on in order to ensure that what we're doing is creating positive benefits, and we're mitigating any type of possible negative effect. And so the reassurance that that's really a part of the process and a high focus for every visit makes me feel great about the process, for sure. The staff was awesome. I think certainly the beauty for me in the consultation that I did after my blood test with the primary physician here was leaps and bounds better than the experience I had with some of the other services that I've invested in. So after the 90 days, if I feel like I'm successful, it's the joint pain being reduced. Without a doubt, I've had tendonitis in both of my elbows. That's been plaguing me for next to 6 months, 7 months, I think. And so that has prohibited some of the things that I want to do from an exercise perspective and play perspective. And so finding a solution to try and solve that is a big one for me. Increasing, I hope to have after 98 days, better energy levels. better energy levels later in the day. And so ideally, a little more energy in all aspects of my life, whether it be being able to work into the late hours or feeling motivated and driven to get into the gym and push myself really hard. And then of course, finding time to feel romantic with my wife. I think hopefully after 90 days, like I'm checking those boxes. You know, I mean, the depth of understanding that I was able to get, the list of options that were made available, kind of the menu that I was given to be able to define what I want to do, what I don't want to do, what I think is most important to me, was certainly way more well-rounded, I guess you'd say, than I was offered in the other experience that I had. And then just my opportunity to learn through the process, like, you know, maybe this is just me, but I kind of like to know when I'm injecting things into my body, what are the things that I can expect on the positive, what are the things I should be concerned of on the negative side. And I feel like I got a really healthy walk through both aspects of this, and a really clear view of, hey, these are the things that could be negatively affected that you may want to watch, and these are the things that you can expect on the positive attribute side. You're either going to spend the money now staying healthy, or you're going to spend the money later trying to get yourself back to health when you're sick or ill. Get off the fence and jump in, to be totally honest with you. I mean, the reality is, like, knowledge and information is power. This type of environment, the mitigating aspect of making sure that you're causing no harm and helping your patients, and the opportunity to put myself in a position where at 50 I can hopefully play well into my 70s. That's exactly what I want in my life. That's what most of my friends want in their lives. So you'd be silly not to make that investment, in my opinion.